pre the Polio Plus people prepared this slideshow, and I thought I would use it as is because I can forward it to anybody. It has notes, and I will be reading from those notes. So you would be able to give this presentation anywhere at any time, and you could make your own little adjustments to it. I will have a couple of my own adjustments in here. Yesterday, I talked at the Frankenmuth Noon Club, and I had about a 10-minute presentation, which I could share with anybody who wanted it. It would be just the notes from that presentation. So it might make it easier for someone to give a short presentation to their club or to another club. But as you can see from this slide, we have a dedicated health worker, a smiling mother, and a child forever protected from paralysis by the polio virus. This is what Rotary's Polio Plus program achieves. Our ultimate goal of a polio-free world is possible, and with your engagement and support, we can fulfill our promise to protect all the world's children from this paralyzing disease. Today, we'll discuss four main topics: a brief reminder of what polio is and the partners we work with to eradicate it, an update on the status of these eradication efforts and the progress toward our goal, a description of Rotary's role in ending polio, and how we all can contribute to achieving a polio-free world. What is polio? It's a highly infectious disease caused by the polio virus. It's spread from person to person, typically through contaminated water, and it can cause lifelong paralysis or even death. And it usually affects children under the age of 5 and is most prevalent in areas with poor sanitation. The Global Polio Eradication Initiative is a public-private partnership led by national governments with 6 core partners. The GPEI was established in 1988, 3 years after Rotary launched our Polio Plus program. We have made tremendous progress in our eradication efforts. In 1988, there were 350,000 cases of polio in 125 different countries. Now the wild polio virus remains endemic in only 2 countries, Afghanistan and Pakistan. They reported just 12 cases of polio caused by the wild polio virus in 2023. Today, 5 of the 6 World Health Organization regions are certified free of wild polio, and 90% of the world's population lives in polio-free areas. This is truly a major achievement, and one to which Rotary and our members have made historic contributions. Through the efforts of Rotary and our partners, more than 3 billion children have been immunized. This means that more than 20 million people who otherwise would have been paralyzed are able to walk. We can also measure our progress by the eradication of 2 of the 3 types of wild polio virus. Type 2 was certified eradicated in 2015, and Type 3 was certified eradicated in 2019. Today, only wild polio virus type 1 circulates in Afghanistan and Pakistan. The wild polio virus remains endemic, meaning it has never stopped circulating in Afghanistan and Pakistan. In 2023, 12 cases of wild polio virus were reported from limited geographic areas of these 2 countries. But as of September 26, 40 cases of the wild polio virus have been reported, 21 in Pakistan and 19 in Afghanistan. This large uptick seems to have been caused by the terrible flooding in Pakistan, which resulted in millions of refugees. Many of these refugees are now returning to Pakistan. Other issues are caused by the Taliban. We don't have enough women workers to be able to go into Muslim homes. There's a lot of vaccine resistance still in these border areas. In addition to wild polio virus, let me, the GPI is addressing outbreaks of variant poliovirus types 1 and 2, with type 2 being the most prevalent. We're not, there we are. The unfortunate truth is that in very rare cases, if the live weakened virus used in the oral polio vaccine circulates in communities with low immunization rates for a long time, it can genetically revert to a form that can cause paralysis. What's important to remember is that vaccinated children are protected, which is why it's critical that we continue to carry out thorough immunization campaigns that reach every child with the vaccine. We and our partners have also deployed a new tool to address outbreaks caused by a variant poliovirus. In 2021, we introduced the novel oral polio vaccine type 2. It's more genetically stable and far less likely to revert to a form that can cause paralysis. It is safe and effective and is now being used widely with positive results. As one example, the Democratic Republic of Congo has had a dramatic decline in this type of variant poliovirus since it began using the new vaccine. In Gaza, we have been using this vaccine. In August, a 10-month-old child was paralyzed early in the month. So far this month, in the first 2 weeks, we have vaccinated about 580,000 children. And we're going to follow up in another 4 to 6 weeks to revaccinate all these children. We are focusing our current efforts on the wild and variant poliovirus in 5 key areas considered to be the engines of transmission. They are Afghanistan and Pakistan, where we've already noted that the wild polio virus is still endemic. The areas of focus also include northern Nigeria, eastern Democratic Republic of Congo, south central Somalia, and northern Yemen. And while these are the major areas of focus, we are responding to outbreaks wherever they may occur. The GPI Initiative's Polio Oversight Board, on which Rotary is represented by the chair of its International Polio Plus Committee, it determined in July 2024 that more time will be needed to achieve our first and second goals of our strategy. And so they extended the timelines to achieve both. They assessed that goal 1 could be achieved by end of 2027 and goal 2 by the end of 2029. They also considered the additional resources that will be needed to fund activities beyond 2026 and will adopt a revised multi-year budget in October. All the achievements on this slide are in addition to what we mentioned earlier, that more than 3 billion children have been immunized and more than 20 million people were kept from being paralyzed. We also, sorry, we've also eradicated 2 of the 3 types of wild polio and worked to get 5 of the 6 world regions certified polio-free. This all reminds us of how close we are to keeping our promise of realizing a polio-free world for children everywhere. Rotary's main roles in polio eradication are fundraising, advocacy, and raising awareness through the active engagement of our members. Rotary members that raise funds, immunize children, promote awareness in their communities, and secure support from governments, non-governmental organizations, corporations, and the public. Rotary is committed to raising $50 million per year for polio eradication, and the End Polio Now campaign is the vehicle for that. Through our partnership with the Gates Foundation, every US dollar Rotary commits to polio eradication is matched 2 to 1, up to $50 million a year. We encourage individual members to donate at any level they can. Our district goal is $60,000. Rotary asks each club to give $1,500. We ask each club to become a polio eradicator club, an average of $45 per member. We did this because we don't think it's fair that a club with 100 members gives the same amount as a club with 10 members. This way we feel it evens out. And $1,500 will get your club a nice certificate, but Polio Eradicator Club will get you a beautiful badge designed here in Bay City. Our district, uh, our district started a Polio Plus Society. Each member commits $100 per year until polio is eradicated. More than 10% of our district members have already joined. We so appreciate the funds that Rotary members raise that result in the Gates Foundation match. With that money, Rotary funds operational support and technical experts, vaccines, disease surveillance, social mobilization, research, and stipends for hundreds of thousands of volunteers who immunize our children going house to house to vaccinate those kids. In this chart of 2023-24 spending, the category Other includes that funding for surveillance, research, and technical experts. Another important aspect of Rotary's work is advocacy with donor governments, such as Germany, the UK, US, Japan, Canada, Australia, and others that provide critical funding to the GPEI. Past trustee chair Ian Reesley represented Rotary at the GPEI's pledging event in 2022 during the World Health Summit in Berlin, along with other global leaders. There are 17 Rotary-appointed national advocacy advisors in the donor countries who engage with their governments to encourage support. Rotary also advocates for officials in countries affected by polio to prioritize our eradication efforts and to conduct high-quality vaccination campaigns and stay committed until we end polio. One example is Rotary leadership meetings with heads of state. In this photo, Pakistan National Polio Plus Committee Chair and the past Rotary Foundation trustee, past director, International Polio Plus Committee Chair, Chair Mike McGovern, and others meet with Pakistan's Prime Minister to encourage sustained commitment to polio eradication, recognize the work that the government is doing, and encourage accountability and leadership. There are 24 national Polio Plus committee chairs who engage with government leaders in countries where polio is endemic, where outbreaks have occurred, or where there is a high risk of an outbreak occurring. Raising awareness is another important role for Rotary. We encourage all members to help their communities learn about the threat of polio and Rotary's historic role in the eradication effort. Although this work can occur throughout the year, World Polio Day on 24 October and World Immunization Week in April are two key times to engage people and boost Rotary's public image. Sample social media posts, event toolkits, and other materials are available on endpolio.org. From events in your community to gatherings at iconic locations, all members can increase the visibility of our polio eradication efforts. Seize every opportunity to raise awareness of the historic opportunity to end polio now. Rotary leaders and members at events such as the International Assembly and conventions also help raise our awareness of our efforts to eradicate this disease. How do we achieve a polio-free world? We work together and maintain our commitment. Achieving this goal requires us to reach up to 400 million children per year to sustain high levels of immunity. Hundreds of thousands of frontline workers are needed to go door to door, house to house, seeking children under age 5 to vaccinate multiple times per year. Pakistan alone has more than 300,000 frontline workers. In addition, we need to intensify our disease surveillance activities by searching for the virus in children and the environment. This surveillance helps determine if and where the polio virus is circulating and is used to determine when it stops circulating. If the polio virus circulates anywhere in the world, it's a threat to children everywhere. If we stop our eradication efforts now, polio will rebound. Within 10 years, 200,000 children would be paralyzed by polio every year. We cannot let that happen. We've accomplished so much in our efforts to eradicate polio, but we can't stop now. I hope everyone here today will consider making a contribution to Polio Plus so that we reach our $50 million goal and fully leverage the match in order to reach even more children with the vaccine. Get engaged and encourage other members to do so by creating or joining a Polio Plus society. Help sustain the commitment of leaders at every level by communicating the benefits of immunization against polio and other diseases, and advocate for continued financial support. And use events like World Polio Day and World Immunization Week to highlight Rotary's role in the eradication effort and the opportunity to eradicate a human disease for only the second time in history. We all have a role in the effort to achieve a polio-free world. Help ensure that polio doesn't paralyze any child again by supporting our eradication efforts. Together, we end polio. Thank you.